In the previous presentation, we discussed 7 health-related tips. Knowledge of those points should help to take credible decisions on both preventive and remedial measures compatible with better healthcare. The link in the top right corner will take you to our previous presentation. Add link on Series 1. As mentioned in the previous series as well, a pertinent question can and should be asked: who are we to preach health and sickness to common people when luminaries from pharmaceutical industries, research circles, hospitals and insurance companies are saturating internet with their version of healthcare products and services? Are we regurgitating information from the internet and pretending to be experts? Is our hidden agenda to trick viewers and subscribers for monetary gain? We must confront these legitimate questions with convincing answers. Facts are, we are founders and owners of St. James School of Medicine. It is a relatively new medical school run by a team of highly qualified doctors, researchers, and administrators. School has graduated over 600 successful physicians over the last 20 years. They are practicing medicine in various states of USA and Canada. Cost of completing an MD from St. James School of Medicine is 1/3 that of any private medical school in India and half that of USA. Here is a glimpse of our alumni. This is the group of students who have completed 20 months of coursework in Anguilla campus. It is one of the 2 campuses located at Caribbean Island. Other one is in St. Vincent Island. You may get more information from the website www.sjsm.org. Feel free to check us out and return with any question related to your health conditions. We counsel diabetes, hypertension, obesity, and pain with the concept of integrative medicine and follow up your progress until you are satisfied. At the beginning, we mentioned there are 10,000 known diseases that affect human body. About 10 of them, according to WHO sources, are most prevalent in South Asia. These are cardiovascular disease, stroke, respiratory disease, tuberculosis, COPD, which is chronic obstructive pulmonary disease, diabetes, Alzheimer, malaria, diarrheal disease, and malignant tumors. Any government leadership, including South Asia, with special reference to India, if they target aforesaid 10 diseases and mobilize resources of the state-run hospitals to treat and prevent just these 10 diseases, health condition of general population is likely to improve significantly. During the last 75 years, no examples can be found that shows ruling class and their bureaucracy have executed any public healthcare program that has genuinely benefited common masses. Will the general population be left alone to be ruthlessly exploited by private healthcare providers? Do general public have any alternative? Yes, they do. Why not approach general public through the social media and let them be guided to seek modern treatment in combination with alternative integrative medicine that is rooted into thousands of years of tradition with proven records. It is said, knowledge is strength, so let's explain some of the most common ailments that cripple vast majority of general public with basic knowledge at their disposal. Public may have fighting chance to make credible decision on how to stay on the right track to retain good health. In this context, our first topic of discussion is type 2 diabetes. Diabetes may be the result of different types of abnormalities. 2 variants have been identified, primary and secondary. Primary diabetes, this condition is further subdivided into type 1 and type 2. Primary diabetic condition is identified when either insulin is not secreted from pancreas or for various reasons insulin is unable to influence its target cells to pick up glucose from circulating blood. Primary diabetes type 1. In this condition, pathological conditions in this case appear because for whatever reason pancreas secretes little or no insulin. Formerly, it was also called juvenile onset type diabetes. Now it is said the condition may appear any time in life. Primary diabetes type 2. In this condition, both pancreas and its secretion may remain intact. Only body cells, when become resistant, insensitive to insulin, secreted from a functioning pancreas. Consequent abnormalities in both type 1 and type 2 are mainly rise of glucose level in circulating blood. Secondary diabetes. Blood glucose may also rise, classic symptom of diabetes, due to pathological conditions leading to excessive secretion of hormones other than insulin. Increase in blood glucose level to excessive secretion of growth hormone, glucocorticoid, epinephrine, etc. is diagnosed as secondary diabetes. Here we will discuss primary diabetes type 2. Most of us are familiar with terminologies like high blood sugar, sugar in the urine, insulin, pancreas, gangrene, etc. What is the common thread that links all of them? Instead of dealing with the explanation of how these symptoms originate from a common source, we will explain how type 2 diabetes originate, and contrary to common belief, the disease can be well controlled and even reversed. First important set of information that must be emphasized about diabetes is high glucose level in the blood, above 140 milligram of glucose per 100 milliliter of blood, is diagnosed as diabetes. Remember, high blood glucose is just the symptom and not the cause of diabetes. Okay, second important set of information. What is the cause of primary diabetes type 2 then? Simple and straightforward answer is body cells resistance or insensitivity or lack of response to the signals of insulin. That may lead to series of abnormalities. The main one is rise of glucose level in circulating blood, leading to additional complexities. Look at this diagram. Step 1. This shows food, meaning rice and or bread in the stomach, is broken down to glucose molecules. Step 2. Glucose enters bloodstream. This entry is not facilitated by insulin. Step 3. As glucose level in blood goes up, it triggers insulin secretion from pancreas, which pushes glucose flowing in blood through glucose channels of body cells. Shifting of glucose from blood to cell brings glucose level in the blood slowly down to normal. Step 4. If glucose channels remain blocked by fat droplets, then insulin fails to push glucose inside the cell, so glucose level in flowing blood increases, causing type 2 diabetes. To understand this, it is important to realize that the hormone insulin, like all other hormones, continuously talk or send signal to the target cells. What are some of those target cells of insulin? These are fat cells, that is adipose tissue, skeletal muscle, liver, kidney, skin, and several other organs. Sometimes these target cells do not or can't listen to what insulin tells and or helps them to do. One way to express this situation is target cells for whatever reason become resistant or insensitive to insulin's instruction. This is called insulin resistance or insulin insensitivity, and it is the main cause of diabetes type 2. Rise of glucose level in the circulating blood is only the symptoms of any kind of diabetes. Let's take a quick look at two animated presentation of the process just described.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance.
A second animated presentation makes it even clearer.
In this video, we have prepared a simple analogy to help explain it. Try thinking about it like this. You're home alone and you realize you're hungry. So, what do?
I'm so hungry, but I don't have anything to eat in my fridge. I know. I'll order a pizza. 1 large pizza, please?
The pizza man hurries to your house and approaches the door. He needs you to open the door so he can give you your pizza. So, he rings the doorbell. There's no answer, so he rings again. Sadly, your doorbell's broken, and you don't hear it ringing. So you don't get up to answer the door, and the pizza man can't give you your pizza. Even though your pizza's right outside your door, the broken doorbell means you don't get up to let it in. With a broken doorbell, there's nothing the pizza man can do. So he leaves the pizza outside and walks away. You're left at home and hungry. I bet you're wondering how this relates to diabetes. Well, the process of the failed pizza delivery is basically the same process as type 2 diabetes in our bodies. Think of the girl in the story as a cell. Cells are the basic biological units that make up our body. They need energy to carry out their various functions. The pizza represents glucose. Glucose are basic units of food, which the cells in our body burn to obtain the energy they need. The pizza man is the same as insulin in our bodies. Insulin is a hormone produced by the pancreas. It is responsible for signaling the cells to open up their doors or channels to let the glucose in. Lastly, we have the doorbell, which represents an insulin receptor. In this case, a broken doorbell, which represents an insulin receptor that is not functioning properly. In type 2 diabetes, the insulin receptors are broken. So even though glucose is in the blood, and insulin may bind to the receptors like normal, the cells become insensitive to the insulin and do not open their channels to let glucose in. The cells can literally be surrounded by glucose, but starving because they can't let the glucose in.
Now let's proceed further to understand what are the instructions of insulin to target cells like liver, fat cells, and skeletal muscle cells. How and why do target cells become resistant to insulin's instruction? In case of liver cells, the insulin promotes synthesis of glycogen, stored form of glucose. Glycogen is a stored form of glucose. It inhibits glucose production through gluconeogenesis, which means synthesis of glucose from sources other than carbohydrate. Also inhibits release of glucose through breakdown of glycogen, which is also called glycogenolysis. In case of skeletal muscle, insulin tells the skeletal muscle to pick up glucose from circulating blood, and at the same time tells them to stop burning fat. In presence of high amount of insulin, streaks of fat may develop around each muscle bundle, that is, clusters of muscle cell. In case of fat cells, insulin tells fat cells, that is adipocytes, to do two things. One, to pick up glucose and fat globules, that is droplets, from circulating blood. And two, not to release their stored fat droplets into the circulating blood. This means presence of high amount of insulin prevents the release of stored fat droplets in the circulating blood, causing high accumulation of lipid in each fat cell, leading to obesity. This also means everything should be done to avoid excess secretion of insulin from the pancreas. This diagram shows the effect of insulin on the cells of liver, skeletal muscle, fat, and cells of blood vessels. Upward-facing green arrows points to actions that prevents rise in blood glucose. ENOS, endothelial nitric oxide synthase, is a vasodilator. Now that we know how insulin talks to fat cells, skeletal muscle and liver cells, let's try to digest following 4 sequence of events and visualize how after a meal, glucose originates from the carbohydrate type of food, and under the supervision of insulin, how glucose is stored in the liver as glycogen. Also, how excess glucose is converted to lipids and stored in the liver. Here are 4 sequence of events. In this diagram, we can see how insulin is released from pancreas. Inset to the right shows it is from clusters, isolates of beta cells inside pancreas that secrete insulin. Now see, main diagram shows yellow globules. Insulin facilitates entry of blue globules, glucose, through the glucose channels of liver and muscle cells. Note, insulin is not required to push glucose to enter into the capillaries twining around digestive tract. As we will explain later, if and when glucose channels are blocked for some reason, then glucose from blood can enter cells of liver or muscle or skin, kidney, etc. So glucose level rises, leading to diabetes type 2. We will discuss in further detail why insulin sometimes fails to push glucose through channels into cells. Insulin is secreted continuously. A normal person may secrete about 50 units each day. Estimated 0.1 to 1.3 units is secreted each hour. Ingestion of any kind of food except fat stimulates pancreas to secrete insulin. 1.4 units of insulin is secreted after eating every 12 grams of oral glucose, equivalent to a slice of white bread or a small fulka. 2 pieces of bread or 2 fulkas will induce secretion of 2.8 units of insulin. Obese person may secrete as much as 200 to 250 units of insulin per day. Carbohydrate from meals in the small bowel is broken down to glucose, which passes into blood, flowing through rich capillary network of the small bowel. Glucose transport from the lumen of the small bowel into its capillary network is not dependent on insulin. Under the influence of insulin, glucose-rich blood from small bowel gets inside cells of liver, skeletal muscle, and fat cells. As a rule of thumb, liver cells convert about 100 gram, that is 20% glucose, into glycogen, which is stored form of glucose, and muscle cells convert 80%, which is 500 gram glucose, into glycogen, which we have referred as food from within. When glycogen storage reaches its capacity, then extra glucose molecules in the liver cells are converted into fatty acids, that is lipids, and the process of converting glucose into fat is called de novo lipogenesis. Excess synthesis of lipids in the liver causes excess fat storage, leading to fatty liver. In this presentation, diagram shows as liver cells convert more and more glucose into fat droplets, and fat gets accumulated in the liver, leading to fatty liver and distension of abdomen. So measurement of abdominal circumference is used as an indicator of fatty liver. This explains why frequent eating is unhealthy. Based on the same principle, cattle and ducks are fed with excess amount of refined grain, corn and soy, to stimulate fat synthesis in the liver and skeletal muscles. Same applies to human species as well. When cells of muscles and liver become saturated with stored fat, they are unable to pick up glucose from circulating blood, because fat seals glucose channels on the cell membrane like chewing gum, may seal a keyhole. As a result, two things happen. One, glucose level in the blood rises, and two, cells do not get glucose from carbohydrate to make energy, which is ATP, required to do the work a cell is assigned to do. Since cells are already full of glycogen and fat, which is lipid, insulin can't push any more glucose into the cells, which is what insulin is supposed to do. This means cells become insensitive to the instructions of insulin, or another way of putting it is cells become insulin resistant. Insulin resistance is the same as insulin insensitivity. Insulin resistance develops over many years or decades of exposure to wrong diet and misguided healthcare. From the explanation above, it follows prolonged use of refined carbohydrate and processed food in the diet may lead to accumulation of fat in the liver and skeletal muscle. Liver and skeletal muscle, when saturated with lipid storage, is unable to pick up glucose from circulating blood that may lead to rise in blood glucose level. High blood glucose may lead to further increase in insulin secretion. High insulin may lead to 1. Further accumulation of fat in the liver and skeletal muscle. 2. Low glucose uptake and utilization because storage of excessive fat blocks glucose channels. The way chewing gum blocks keyholes may lead to further rise in blood glucose, triggering more insulin secretion, causing a vicious cycle. At this stage, a person may be classified as pre-diabetic, meaning on the way towards developing diabetes, and showing abnormal features called metabolic syndrome. Here is an illustration that explains how the vicious cycle develops.
Type 2 diabetes is a little more complex because there's slightly more processes at work. Either the body isn't producing quite enough insulin, or the insulin it is producing isn't working properly. That can be due to being overweight because a build-up of fat can stop insulin doing its job properly, but it can also happen in people of a healthy weight. So in type 2 diabetes, the carbohydrate-containing food is broken down into glucose in the stomach and digestive system as normal. That glucose then moves into the bloodstream. The pancreas starts to produce insulin, which moves with the glucose through the bloodstream to all the body cells which need glucose for energy. However, the glucose can't always get into the cells because the locks to the cell doors have become furred up with fat deposits. That means that the insulin can't open the cell doors properly. So the level of glucose in the blood continues to rise. In response to this, the pancreas produces even more insulin. So the blood glucose levels continue to rise and the insulin levels continue to rise. This situation is further complicated by the cells, which are desperate for energy, sending out emergency signals to the liver to release stored glucose. The blood glucose level goes up, and the pancreas produces more and more insulin until it can't cope anymore, and eventually it can wear out.
Correction is to reduce endogenous insulin secretion by depleting fat and glycogens. Fat and glycogen storage from liver and muscle. But how? This will be discussed in detail in the section of treatment. Before we deal with the treatment of diabetes by reversing insulin resistance, let's explain how to determine that you are indeed a victim of insulin resistance. A few simple tests should reveal that decisive information. The method is divide your height in inches with girth of your waist measured 2 inches below navel. Score value should be below 2 points. Reading above 2 points indicates excess fat in your abdominal area. Here is a photo showing how to measure. Fasting insulin test. This blood test determines whether insulin secretion from your pancreas is normal or abnormal. Get this test done and note the data should range between 2.6 to 6. Reading above 6 indicates insulin resistance. High sensitivity, that is C-reactive protein, that is HSCRP in brief. The test. This blood test measures general level of inflammation and estimates the risk of heart disease and stroke. Get this test done and note a reading below 3 is supposedly risk-free. Blood profile is evaluated. Dividing score of triglycerides by the score of high-density lipids, HDL, also called good cholesterol. Resultant figure, if below 2, means normal insulin level. Score higher than 2 means high insulin level or possible insulin resistance.